In celebration of National Health Center Week, the Alameda Health Consortium and Community Health Center Network, I want to take this opportunity to thank everyone who works at one of our health centers for their incredible work and dedication over the last year. We've all just lived through an incredible 15 months that none of us could have anticipated in facing a worldwide pandemic. And it's really warmed my heart to see how all of our health centers and all of our health center staff have stepped up to the plate in a Herculean effort to overnight switch from in-person care to virtual care while continuing to provide medical services, dental services, behavioral care services, prenatal care, childhood vaccinations, while at the same time responding specifically to COVID, the testing of tens of thousands of Alameda County residents, doing contact tracing for people who got the disease, and ultimately vaccinating tens of thousands of residents of our county with the COVID vaccine. The trust that our health centers have earned in their communities is actually the most important asset we have. And we've seen this more clearly during the pandemic than any other time. My hope for the future is that we have more tools in our tool chest than ever. We have better relationships with other community organizations, stronger relationships with faith-based organizations, stronger connections to our patients, and hopefully we can take this trust we have with our patients and go back to all the health problems that existed in our communities before. Chronic diseases, the need for preventive health services, the need for mental health services, and hopefully we're going to be even better able to address those issues in our communities. The short films that you're about to see for each of our health centers are just going to give you a little glimpse into what's amazing and special about how our health centers have responded to the pandemic, using both the trust that they've earned over these decades with their communities, but also their incredible ability to tailor services to meet the specific needs of the communities they serve. And that's really the superpower or the secret sauce of our health centers, being rooted in their communities, being responsive to their communities, being able to quickly adapt how they provide services. And you'll see that in the movies that you're about to watch.
It's a privilege to be able to really know your communities, really intimately understand them, speak their language, and be a trusted source. Asian Health Services serves patients in 14 Asian languages, in person, face-to-face, and on the telephone as well. And it's really that in-person language access that really sets us apart.
It's not just language and interpretation and translation. It's really about being culturally competent, about understanding what the history is for these patients, what their needs are, and being able to support them as a cultural broker.
When the pandemic hit, our patients went underground. They didn't show up for their appointments. They were too scared. When things first started, the services that are available were only in English. So if you couldn't read in English or even have access to internet, you were shut out of those services to get testing, to have access to all the things that we would need to get through the pandemic. We knew that this was our time to step up and be that safety net in addition to primary care services, providing services for testing, for contact tracing, for vaccinations.
When the vaccine came up, we were able to move quickly, opening up our clinic overnight. I think we're close to providing 25,000 vaccinations.
What we saw during COVID was that our population had experienced high case fatality rates and hospitalizations, but all of the suffering was rendered invisible.
And then at the same time, the narrative out there was so much around us causing the virus, which we know isn't true, but yet it was this double standard that we were facing, that we were both blamed and ignored for services.
Our mission is dual. It's about services and advocacy, and they go hand in hand. And that is what we really strive to do, is to make sure that all of our patients, that they're able to assert their right to health care.
Asian Health Services has truly been a lifeline for our patients and the larger community.
It's been such an honor to be able to utilize my skills and my language and my education to give back to the community.
Some of the struggles that we saw arising in behavioral health in particular during the pandemic were depression, anxiety, and trauma.
Access serves a really diverse range of residents in the Tri-Valley, all the way from immigrants who have just come to the United States to families who had originally settled our areas and are still ranching or farming. We serve the people who are most vulnerable, the people who wouldn't otherwise have access to health care.
In our behavioral health department, we had a huge influx of patients requesting support. We treated so many more patients than we would have in a regular period of time. As COVID-19 hit, we transitioned to telehealth services in our behavioral health department over the course of a week. So it was a pretty quick transition. As the pandemic continued, we also needed to kind of brainstorm about the way in which our patients would access telehealth services. One is that they could come into the clinic and utilize one of our empty rooms. And then later on, it became necessary to have another backup option, which was a drive-up option. We saw a lot of struggling kiddos in particular. When kids were unable to attend school, we saw a large increase in depression and isolation. And now we're seeing a lot of increased social anxiety around changes related to going back to school. Counseling became a really helpful avenue for them to talk about their struggles and for us to help them brainstorm around new skills that they could use. We really encouraged use of either our drive-up option or the in-clinic option. It led to them having more privacy when they came in the clinic. One huge success is that we really made a huge effort to support our staff. We didn't lose therapists due to burnout or anything like that during the pandemic.
One of the biggest successes we've had is just realizing how resilient and wonderful our workforce is.
All right.
Whoever I'm working with in the Access team, everyone is doing something, touching some family that's going to improve their health and their livelihood. We're making an impact, however small or large.
The pandemic gave us an opportunity to rapidly expand services to nearly 100,000 people.
Bay Area Community Health has 26 different clinics. We serve patients in both Alameda as well as Santa Clara County. This is a whole person care. That's what our mission is, to provide exceptional quality of healthcare and social services to our patients and our community here. So it's very important for a community health organization to be at the forefront because we are serving a lot of patients, and especially this is the population in which the health disparity is a huge factor. We always had the health disparity, we always had the health inequity, but during this pandemic, this has all come up.
Bay Area Community Health has operated mobile services for a number of years now. And our response to the pandemic was a very quick adaptation to expand and to move from health services to testing and subsequently the vaccination process.
Back in April of 2020, we started offering free testing, not just to our patients, but also to our community. We've always utilized our mobile vans to serve our clients where they are. So it was even before the pandemic, that was our vision. I believe this also reduces the health disparity. People who don't have access, they don't want to come out. They're in shelter in place. There were no public transportation at that point in time. People don't have car. They can just walk into the places like BART station, to the different colleges nearby, to the schools to come and get tested. Right from the beginning in January of 2021, we offered the vaccines to our community here in Alameda as well as in Santa Clara County. We do have fixed sites, but in addition to that, we have been providing several pop-up events. We have done so far more than 60,000 vaccinations since January of 2021.
Our 8 mobile services have been deployed through pop-ups and through the mobile site schedules so that we, once again, could take the services to the patients.
Just a quick pitch,
The thing that makes me get up in the morning is that I am making a difference in people's life, not just our patients and community, but also for our staff. It's a team care, team approach. That's what we do here, and that's why I'm really excited and I'm so proud of working with my Bay Area Community Health team.
It's been so inspiring this year to watch as a pediatrician everything that my patients' parents have done to try to get them through this year, to try to navigate doing homeschool, to try to give their kids all the support they can while they've been struggling financially often themselves. La Clinica has sites across 3 counties. We serve a really diverse population in each site. Here at Transit Village and Fruitvale, we serve a really big immigrant community. Most of our patients are Spanish speakers from Mexico and from Latin America. From the very beginning of the pandemic, it became clear very quickly that our patients were being disproportionately affected by COVID.
So for a while during the pandemic, this particular zip code of 94601, which is the Fruitvale district in Oakland, did have the highest rate of COVID-19 infections in the Bay Area, which is never a distinction that you want to have.
So many people lost family members and friends during this time, and we just continue to keep our doors open. We continue to make testing available.
It's really heart-wrenching to hear all of these stories and feel like, you're trying to do your best to help them. With our testing and contact tracing, I'm really proud of the work that La Clinica has done in terms of how many people we were able to test throughout the pandemic. We've tested tens of thousands of people, probably about half of which were La Clinica patients, and the other half was just anyone in the community who needed a test.
We're really proud of our vaccination program. As an organization, we've given almost 40,000 vaccines in the past few months.
We've just devoted every possible resource, pulling medical assistants and nurses and physicians at times from the clinics in order to get them out at our vaccine site so that we could get as many shots into arms as possible.
So I think as we work towards a path to recovery, there is a population that still hasn't been vaccinated that we're going to try really hard to reach. I think over time we'll be pivoting from doing big mass vaccination clinics where we might vaccinate 400 or 500 people per day to doing smaller outreach events where we'll be going more into neighborhoods, to grocery stores, to housing communities to make it as easy as possible to get vaccinated.
¿Qué tal? ¿Cómo estás?
Bien, ¿y usted cómo está?
We're the front line of defense in a global pandemic, but I think another really important role that we play is just being there in support of our communities and not just treating them for COVID-19 infections or screening and testing for COVID-19 infections, but also taking care of that whole person in all the other ways that they're impacted economically, mental health-wise, academically for kids, and just finding all the ways that we can really support that whole family and all aspects of their life during a pandemic.
I came to community health because I was a young father and got quite ill and didn't have anywhere to go to get health care. Health equity has been highlighted during this pandemic, and it's become even more clear that there are those who are not experiencing health access and health equity, and we have to fix that. So today we serve folks that are unhoused, those that are elderly, those that are in schools. We're really proud of the Trust Center, which is here in downtown Oakland in the urban core. And you just have to walk through here and understand we're really interacting and taking care of the most vulnerable folks on the street.
The patients that we have at the Trust Clinic are either unsheltered or unstably housed. And that cost is an incredible mental toll and physical toll, which, as it relates to the pandemic, meant that many people had comorbidities that put them at high risk for complications from COVID. Because of the shutdowns that happened, patients found themselves struggling to survive, not from a COVID perspective, but from a where am I getting my next food? Where am I going to get clean water? All the showers are closed now. I need to find a place to keep clean. That environment caused a remarkable amount of stress. We began to notice that a lot of our patients didn't have phones, and so we needed to find a way to continue to provide care for those particular patients who were showing up to our front door. We had several tents that were set up for COVID testing, but also primary care services. Those relationships that were built throughout the pandemic culminated in many ways in a robust vaccination effort where I think we vaccinated well over 700 of our patients now, which has been a big success. And we also worked with the county to ensure that those patients who were at high risk were able to get appropriate housing, not just temporary housing, but permanent housing.
I'm extremely proud of the fact that Dr. Ranking and his team are out there each and every day addressing some of the most vulnerable people in our culture. Community health centers have demonstrated through the pandemic that we have a great ground game.
The heroics that were demonstrated by our staff give me the strength to come to work every day.
It was actually the Native American community that led me here. And here I am 15 years later. I have a large extended family, and many of them seek services here at the Native American Health Center. We serve a very diverse population that has high-risk health needs. So even before COVID, they were susceptible to COVID in a higher capacity than other people were. Many people living in close quarters, a single home, they can't quarantine from each other. A lot of essential workers. Our community was one of the highest COVID positivity rates in Alameda County, so being able to focus and put effort into this community was extremely important.
What we were able to do was turn on a dime. We were able to go from basic operations right to telehealth over a weekend, and I mean that literally. Our first response was simply to do testing, and then we went to mobile testing. We would go out on site and test at community-based organizations. Our partnership with FEMA started from a phone call from the governor's office. California Office of Emergency Services to find community-based site to complement the mass vaccination site at the Oakland Coliseum. Because of some of the factors of a distrust of government, of language barriers, other cultural barriers, individuals are not always eager to go to a government-run mass vaccination site.
Our main job was outreach to our community. Printed out thousands of flyers and had teams walk them up and down International Boulevard. One person who worked for FEMA, he had never seen something so well scheduled that the word had reached the White House and actually changed the trajectory of how soon people could get vaccinated. We had people from LA who were setting up mobile vaccination sites calling and asking how we did it, Alameda County, other clinics, and so of course we just shared, how we did it. We actually were receiving some vaccine doses from Indian Health Service, and so we prioritized those doses for our Native American population. And it was just beautiful to see our Native American elders who we've known in the community for so long come to us to get vaccinated.
We're very proud to have been able to be part of the solution to inequitable vaccine distribution.
There's been so many times during the pandemic that I've cried a lot of times just because of the good work that's happening. Our colleagues have just been incredibly amazing, working extended hours, putting 110% to ensure that we are providing this service to the community, and that's just been really heartwarming. It was just really an amazing feeling.
We feel that healthcare is a human right, and we have said that, and we have preached that, and we have practiced that, and we have lived that over the last 50 years. I think the pandemic brought a magnifying glass to a lot of the issues that we knew were there, and maybe some that weren't so apparent. Our clinics are in areas that have been disproportionately impacted by the pandemic.
When we started testing, I couldn't quite believe it. For several months in the beginning of the pandemic, we were 20 to 25% positivity rate of those who were tested for COVID, which is far and beyond national, state, county numbers.
Our response initially was focusing on the basics. How do we take care of our staff, and how do we take care of our patients? For our staff, that entailed PPE. For our patients, it became everything from education to making sure that we had testing supplies. As much as I wish we could do it all, we can't. That's where our community partners come in.
We've had a several-year relationship with the Hayward Fire Department. One of our clinics is called the Firehouse Clinic. What's nice about partnering with the fire department is that their staff are also paramedics. And so they have been instrumental with our vaccine efforts and helping us scale up. Tiburcio Vasquez has one of the largest promotores groups in the state.
Promotores are community health workers that essentially provide everything from patient education to doing outreach and advocacy. And what's wonderful about the promotores is that they're folks from the community, so they know our communities really well.
It carries a bit more weight when you're hearing a message from someone that looks like you, someone that may be your neighbor.
Whether it's raining, whether it's freezing, whether it's really hot, they're the ones that are out there handing out flyers, talking to people. They are the folks that mobilize everything that we do.
We are boots to the ground, roll up our sleeves, working in the community, meeting folks where they are.
Community health centers adapt quickly and we're resilient. So whatever comes our way, we take it, we make the most of it, and we continue to do what we do best, and that's serving our patients and our community.
I actually was born and raised in Oakland. I was raised by a single parent, and my mom worked very hard. However, we did not have all of the necessities that we actually needed, so that created sort of a sensitivity toward community health. We have traditionally served the underserved.
We are predominantly African American. 60% of our patients are African American, another 20% are Latino, a very multicultural clinic.
What makes our patients so vulnerable to the COVID-19 pandemic is number one, misinformation, number two, fear, number three, the underlying medical conditions that they have. Another one would be they don't have the luxury of being able to work from home. Okay, they don't have the luxury of being able to socially distance, even within their own home.
Particularly in the African American community, is a much higher hospitalization and severe illness rate. We recognized that this was a public health issue that called for collective action. We partnered with the County of Alameda in providing testing to be made available not only to our patients, but to the community more broadly. Beginning of January, we tested something like 7,000 patients in a month. We've tried to reach out to people in a number of ways.
We actually called our patients and asked them, would you be interested in the vaccine? Even when I do my telephone visit or see a patient face to face, I'll ask them, I'll open up the conversation with, do you have any questions about the COVID-19 vaccine? I got one with your name on it. And I am acknowledging their fears. And I'm not even telling them their fears are ridiculous. I'm not doing that. I'm just trying to educate, then vaccinate.
But I don't know that I would say there's a hesitancy. What I would say is that African Americans try to be smart shoppers. We've been working with our faith-based leaders in this area. We've gone up and down the street to the auto repair dealers, to the halal market.
I would like to compare it to voting. Patients were asking each other, did you vote? Did you vote? Did you vote? I would love to see patients ask each other in the community, did you get your shot? Did you get your shot? The gratitude is seeing the impact of making that difference.